The Molecular Pharmacology Shared Resource of the UC Davis Comprehensive Cancer Center is designed to provide assistance to clinical trial specialists and physicians who are conducting clinical trials here at our cancer center. The shared resource collects over 1,200 unique patient specimens, and we are currently supporting over 100 clinical trials. Many of them with their own unique protocols and processing requirements. Additionally, the shared resource can also provide analysis of those specimens. So in that case, after the clinical trial is complete and we've collected all of the specimens, we store them, then we might analyze them for particular biomarkers that can give us an indication of whether a patient responded well to a particular investigational agent or didn't respond. We might look for markers of resistance that are emergent during the course of treatment. And this will allow us to refine the clinical trial, specifically tailored to those patients who are most likely to benefit from that combination of treatments. One of the key components of the Molecular Pharmacology Shared Resource is what we call preclinical investigations or preclinical modeling. And here we will perform analysis of novel drug combinations in an artificial system, in vitro, in cell cultures, for instance. And that will allow us to get a sense of how these drugs are actually acting against different genetic environments, what kinases they're actually inhibiting, what different pathways are being triggered by these drugs. If we want to perform more advanced modeling, we may utilize our patient-derived xenograft system. This is a fantastic collaboration established between the UC Davis Comprehensive Cancer Center and the Jackson Laboratories. And here we're actually taking tumor tissue, fresh live tumor from a patient here at the Cancer Center, and implanting it into one of the Jackson mice super immune compromised models. And this will allow those tumors to actually grow in a real environment. And the great benefit of this system is that those tumors that are growing in the mice, they're human tumors. They retain the genetic characteristics and the histomorphological characteristics of the originating tumor. And that provides us a much better, much more detailed model to work with than the cell cultures. Throughout this process, we work very closely with our clinical trials investigators. For instance, in the laboratory, we might come up with a particular regimen, a combination of drugs that works great in cell culture, only to realize that such a drug combination cannot be delivered safely in humans. The translational medicine component that we provide through this resource really augments the clinical trials process, provides a lot more information than you would get just by watching responses to patients.
Every single one of our clinical trials these days is based on understanding of cancer biology, and we're really trying to personalize medicine and work on biomarkers and work on select drug targets. For example, a recent clinical trial in pancreas cancer used the resource in multiple different ways. We used the resource to help design our correlative experiments, and we were particularly interested in pancreas cancer in KRAS mutations and whether or not we could detect these mutations in peripheral blood specimens. So one of the things about pancreas cancer is that it is oftentimes hard to get enough tissue on biopsies because of the location of the tumor. Using the resource, we were able to collect specimens. We were able to perform DNA analysis within the resource. We were able to use the latest technologies for highly sensitive detection of KRAS mutations in the peripheral blood. And we were able to demonstrate that the ability to detect this mutation using these highly specific technologies was associated with a worse outcome for patients on this clinical trial. This is an example of the resource being involved in the design of the trial, in the conduct of the trial, and then analysis and interpretation of the results. So it's integral to everything that we do here.